This is a PowerPoint presentation on renal failure by Amy Popa for Nursing 442, Spring Arbor University. In the United States, there are an estimated 25 million people who have been diagnosed with chronic kidney disease, or CKD. Of those 25 million with kidney disease, approximately 700,000 people have stage 5 kidney failure requiring dialysis or transplant for survival. The overall prevalence of chronic kidney disease in the general population is approximately 14%. According to the National Kidney Foundation, statistics from 2013 show that 14% of women and 15% of men have chronic kidney disease. Caucasians constitute 57% of patients receiving dialysis, followed by African Americans at 35%, Hispanics at 18%, Asian Americans at 6%, and Native Americans at 1%. Chronic kidney disease often has no symptoms in its early stages and can go undetected until it is very advanced. For this reason, it is often referred to as a silent disease. High blood pressure and diabetes are the main causes of chronic kidney disease, and there are also factors that may increase your risk of chronic kidney disease: cardiovascular disease, smoking, obesity, being African American, Native American, or Asian American, and abnormal kidney structure. Chronic kidney disease is usually a slow and insidious disease with continuing irreversible reduction in the nephron number and their function. The destruction of the nephron is either a result of specific underlying etiologies or a set of progressive mechanisms. Underlying etiologies include genetic abnormalities, autoimmune conditions, glomerulonephritis, or exposure to toxins. As the nephrons are damaged, the workload of the remaining nephrons is increased to maintain renal function. As further damage occurs, the glomerular filtration rate, or GFR, decreases, which causes progression of the disease toward end-stage renal disease, or ESRD. Chronic kidney disease is defined as a glomerular filtration rate of less than 60 milliliters per minute. As you can see by the table, there are 5 stages of chronic kidney disease, with stages 4 and 5 being severe and end stage, and that's the point that the patient's going to be on dialysis or need a transplant. The picture on the left shows 2 kidneys, the top one being the transplant, the kidney that's going into the patient, a healthy kidney, and the bottom one shows a picture of polycystic kidney disease that's been removed from a patient. Signs and symptoms of chronic kidney disease are often nonspecific, and because the kidneys are highly adaptable to compensate for lost function, symptoms may not appear until irreversible damage has occurred. Some signs and symptoms of kidney disease may include nausea and vomiting, loss of appetite, fatigue and weakness, sleep problems, changes in urination, swelling of the feet and ankles, persistent itching, shortness of breath, hypertension or high blood pressure that is difficult to control, and decreased mental sharpness. Individuals with chronic kidney disease are one of the most symptomatic groups with chronic diseases. In many ways, kidney disease is unique among medical conditions with regards to the challenges it brings. Demands affecting quality of life for these patients include dependence on dialysis for survival, functional limitations, alterations in sexual function, dietary and fluid constraints, and ingesting handfuls of medications to treat illness. Other personal demands include time constraints, loss of employment, loss of autonomy, changes in self-perception, spirituality issues, and fear of death. African Americans and Hispanics are more likely to have chronic kidney disease than Caucasians. It's important for the nurse to recognize racial, ethnic, and socioeconomic differences that contribute to disparities in the treatment for patients with renal disease. It is also important for nursing to promote health for the patient by empowering their patients to improve health and well-being by taking control over their disease, and also promoting self-efficacy, self-regulation, and allowing the patient to set attainable goals. Health promotion and education is important for these patients. Tools and interventions by the nurse for patient education should include nutritional assessment, guidance with physical exercise, smoking cessation, continuous monitoring of prescribed medications, and lifestyle change guidance. For those patients with the later stages of chronic kidney disease, 3, 4, and 5, the role of the nurse must also include education about renal replacement therapy, types of therapy, which would include peritoneal or hemodialysis, access routes, AV fistulas, grafts, central venous catheters, or PD catheters for peritoneal dialysis, and they will also need psychological support. This education is especially important as most patients won't be diagnosed until the later stages when it's quickly time to start therapy. It can be overwhelming for the patient, and as a dialysis nurse, I see it almost every time with a new patient. They quickly have a catheter placed for hemodialysis, and they're sent to us with no real information or education as to what is going on. It's very important to sit down with your patient and explain everything.